Hi, welcome to Dr. Rajesh Verma's YouTube channel. In this video, we are going to discuss the problems of adolescents. As you know, the topic of problems of adolescents is a little bit larger and it contains almost three domains where adolescents face their problems. So, in the first part, that is problems of adolescents part 1, we are going to discuss the physical problems faced by the adolescents during the critical stage of their life. That problems can vary. That can vary from various aspects. That can be your eating disorders or risky behaviors, etc. and etc. So, without discussing further on this platform, now let us move to our slides system and discuss the problems of adolescents, that is physical problems, and the topic is part 1. Now let us move to the problems. The image on this first slide, you can see that I put up this, though the topic is a little bit of negative connotations where we are discussing problems, but the image is where these adolescents are smiling, so thus to convey a message of optimism, though they face certain problems but they enjoy this phase too. So to depict that idea, I have used this image where these four adolescents are standing together in their different costumes with smiling or broad smiling faces. So let us introductory part. You know, adolescence is the period of rapid psychophysical growth, or we call it the growth spurt. Due to rapid growth, the adolescent face difficulties in adjusting, adapting with the immediate psychosocial environment. That's a little bit difficult because the adolescent face the adjustment problems because the environment is dynamic. It's also changes. But the physical and psychological growth and changes which occur in the adolescents are a bit faster. So it becomes a little bit difficult for them to adjust and adapt with the immediate psychosocial environment. So the problems can occur in mainly three domains, that is physical, psychological and social problems. So as per this note, the psychological and social problems of the adolescents are discussed in part 2 and part 3 of this video, but in this particular video we are discussing the physical problems. Let us start what the physical problems of adults can be. Eating disorders, there are mainly three types of eating disorders that adolescents face. That is anorexia nervosa, bulimia nervosa and binge eating. These disorders are related with eating behaviors of adolescents which are detrimental for their psychophysical health. In short, I'll define what anorexia nervosa is. It's an obsessive fear, a kind of fear which adolescent finds it difficult to rid of. Of what fear? Fear of gaining weight. And it's an unrealistic perception of body image. That if I eat too much or if I eat something, that will certainly increase my body weight and it will affect my body image. And this nervosa, that is anorexia nervosa, can go up to death. This means what can happen with patients or adolescents who are suffering from this disorder is the major issue is that loss of bones, and this means bone loss, and along with that the loss of skin integrity. This nervosa or this disorder puts excessive stress on the heart, which can lead to heart attack, and it can certain various time it has gone to the extent of death also. Whereas the bulimia nervosa is little bit of just opposite to it. It's a recurrent events of binge eating, where adolescents engage in excessive eating, but after that eating they feel a kind of guilt, and to compensate that they engage in various behaviors using purging as a technique. Purging is a volunteer vomiting used by they use laxatives or diuretics to get rid of that food they have taken inside, to the major issue is that is not the food, that is the guilt feeling due to bulimia, or that is due high eating. And the last, this is binge eating. Binge eating means uh, eating too much in very less time. And with when adolescent is known as a suffering from binge eating is if that individual engage in such type of eating at least once a week and continuously for 3 months. In that case we can say that adolescent is suffering from some kind of eating disorders. We call it a binge eating. And in this there are two things: there is a lack of control over food taking, and one important thing is the feeling of guilt after the taking of food. Some type of eating means that eating is so high that individual feel it difficult to breathe out also. So these are the three major eating disorders: anorexia nervosa, bulimia nervosa, and binge eating. The second type of problems is obesity, acne, and reaction to physical appearance. See, this is an Indian lady so much worried about their physical appearance and their dressing style and various type of costumes. This is not a disorder, but it depicts that how much we are worried about our physical appearance. But that physical appearance, once it goes beyond the normal day-to-day activities, or it interfere with the day-to-day activities, in that case we call it is a problem. So what obesity is? Excessive fat accumulation, where body gets just like the bladder like, and individual becomes just like a football type, or just not a football, but its shape is become so inflated, which have adverse impact on the health. Health means your bone structure, your heart, put more pressure on your heart, then the major impact is on your knees. And the second point is the acne. Acne are natural. Due to hormonal change, acne occur on the face of the adolescent, but they engage in various more often activities, standing in front of the mirror or plucking out the acne artificially, or some with your nails and all. That creates a sense that they are so much worried about their physical appearance. This leads to antagonistic reaction towards the appearance, and finally it leads to frustration and some type of that to aggression too. The third is drug or alcohol use. It refers to, what is drug or alcohol uses? It refers to use of illegal drugs which are not prescribed by the doctors or physicians, and drugs which are banned, and or the misuse of prescribed medicines, or some doctor has prescribed some medicines certain dose, but misuse of that dose comes under the drug or alcohol usage. They tend to entice the adolescents. What the drugs and alcohol entice the adolescents, because adolescents are new. They try to engage with their peers in experimentation with the drugs and alcohol, and they entice this and present a significant danger if adolescents in their growing age, as I told you, it's a growth spurt. If engaged in drugs or alcohol usage, it directly impacts their growth and development, because they interfere with the hormonal system, neurotransmitters, and all body system, and finally it compromises their psychophysical health. Next is risky and illegal behaviors. The adolescents, due to hormonal rush and emotional rush, tend to engage in risk-taking behaviors which may at times prove to be fatal and dangerous for health and social relations. Dear friends, the most risky behavior nowadays is risky selfies. Adolescents are going to extreme extent in taking these risky selfies, and various adolescents are losing their life too in these behaviors. And they engage in illegal behaviors, or the behavior which are not accepted by the society or the law, and that affect not only their social relations, their health, and they sometimes become fatal and very very dangerous for their life too, and society also. Next is your interpersonal violence. The adolescents tend to engage in violence more often, because they have emotional rush, hormonal rush, and body growth. They feel that we can do it and we will do it, and they have a feeling of, I told you earlier, that personal fable, that I am unique and I am immortal. Nothing can happen to me. I am invulnerable. Nothing can affect me negatively. They have that such type of feeling. Due to that feeling and growth spurt and found new strength, they engage in violence. which can lead to certain type of death. And dear friends, you will be astonished to know that the major cause of death among violence is this among the adolescents is the interpersonal violence, because they have lesser control over their emotional behavior. The violence is the outcome of rage, that is anger. That anger may come from frustration or various other factors, depression or maladjustment. Dear friends, let me tell you something about depression here. Depression is a major mental health disorder, and it is manifested by sadness or lack of interest in day-to-day activities, or lack of physical and emotional problems. Then it decreases your work efficiency. Further, it is a lack of interest in pleasurable activities which were pleasurable earlier. Earlier you enjoyed some activity, now that activities are no more interesting to you. It's a sign of depression. And depression can weight gain or weight loss too, can lead to. Then it can lead to feeling of guilt or worthlessness, and it is a very difficult, or it's very difficult to concentrate during a depression. And dear friends, the major problem, or it can lead to suicide ideation too, that is depression. It's a very big issue, and it is steadily rising among the world population due to various factors, which discussion of which is beyond the scope of this video. Next is hormonal disorders. These disorders, as the name suggests, occur because of production of too much or too less hormone during adolescence. It have negative effect on the metabolism rate, functioning and development of the organs, bones and tissues. Dear friends, one of the most important thing during the adolescence is the appropriate amount of production of hormones. If the production is lesser or is it too much, it certainly interferes with the growth and development, and that can affect the organs also, the bones and tissues, and overall body health and physical appearance and everything. Certain factors which can put on can be responsible for the hormonal disorders. And dear friends, next we'll go on to discuss is the iron deficiency. It's the most important mineral needed for the human body. The intake of improper and irregular diets lead to iron deficiency in the adolescents. One thing I'll let you know, the iron is not made by the human body, not synthesized by the human body. It has to be absorbed by the food we take. So during the adolescence, the growth spurt, body needs more iron. For that iron, the food has to be fortified with the iron. The easiest way is to cook the cooking of food in the iron utensils or taking iron supplements. Dear friends, before taking iron supplements, you are advised to take informed advice from your physician. Due to increase in blood volume, that during adolescence the blood volume increases drastically, and muscle mass both they increases. Adolescents need more iron, and the deficiency of it negatively affects the physical endurance and cognitive development. Little bit introduction about iron. What is the purpose of iron in human body? Why we need this iron? Iron is used or needed to transfer of oxygen in blood from lungs to tissues. When blood is a connective tissue, it carries iron. That taking oxygen from the lungs and transferring it to the tissues is the major role of iron. So dear friends, for example, an adult male have almost 1000 milligram of iron in his body, sufficient for 3 years, whereas an adult woman has only 300 milligrams of iron, and which can is sufficient only for 6 months. This means the women or the girls, they need to take more iron to maintain their body and cognitive and physical growth. Iron is very important for your remote functioning. Immune system is very important, and the iron helps in maintaining the immune system at a good level. And adolescents need iron requirement too much because of increased blood volume and muscle mass, dear friends. And one thing more, a little bit information: if you donate a blood, and one time donation of blood, that is 250 ml, if you donate a blood, you are going to lose almost 200 to 250 milligram of iron, but body consumes it, absorbs it. And vitamin C is very important for absorption of iron in the human body. And the minimum requirement per day of an adult is 1.8 milligram of iron. So dear friends, these were the little bit of physical problems faced by the adolescents. These are my references. You can cross check them. And next video will be problems of adolescents part 2. But in that part 2 that video, we are going to discuss the psychological problems faced by the adolescents. Dear friends, by the time if you have any doubt or critical comments too, you can write in my comment box or you can email me at vermasujit@yahoo.com. By the time, if you like this video or the content of this video, you can share with your friends, your teachers, or anyone who is interested in psychology. But if you dislike it or some contents of it, kindly never forget to share with me, because I'll be happy and appreciate you for your critical comments. By the time, thank you for my core effort by watching this video.